Hey guys, my client in Madison, Wisconsin with the old man injury, with the hamstring strain.
Hey Charlie, it's Brian. Appreciated sending me the video with the ideas as to how to test this hamstring. I thought probably the easiest way to respond back to you is to send you a video so you can see what I'm dealing with.
He basically gave me the results of the two tests that I shared with you all last week, the straight leg raise test and the slump test, both of which are looking at nerve sensitivity. The first one is how sensitive it is to tension. The second one, how sensitive it is to sliding, gliding. And I'm going to share with you today the results of his tests, after which I'm going to recommend some solutions and some strategies to help him resolve some of those problems while his hamstring is healing. What I didn't explain last time is that the hamstring sometimes sacrifices itself to protect the nerve, which is already being threatened. It's already on tension, too much tension, or it's in a situation where it could get injured. So the hamstring takes the fall, the hamstring locks up. In this case, he says it feels like it's balled up.
I can feel that there's sort of a knot right here, as well as just an overall tightness in the hamstring.
And as the muscle's healing, it helps to mobilize the nervous system. Test number one was the straight leg raise test. I told him to dorsiflex his foot, pull it up to his shin, keep his knee straight, and then use a belt or a strap to raise his leg up. This is his symptomatic side, where he strained his hamstring. He got up to about 30 degrees, and he was feeling that not only in the back of his knee, but also in his hamstring. And while it wasn't painful for him, it wasn't like overtly reproducing his pain, he definitely had sensitivity that was relieved when he pointed his toe. He repeated that on the other side. On the non-injured side, he got up to about 45 degrees before he felt some mostly discomfort in the back of his knee. He didn't really feel his hamstring on that side, and there wasn't a huge change in that tension when he plantar flexed his foot. We're going to assume that that's his normal side, and that his injured side, as a result, has some heightened level of sensitivity that we need to resolve. The next thing he did was he sat on his kitchen counter with his legs dangling. He slouched his upper back. He slouched his head all the way forward into flexion. He pulled his foot up to his shin on the symptomatic side, on the side he hurt, and then he straightened his knee. He got to maybe 30, 40 degrees before full extension, and he felt it behind his knee, and this time he felt definitely more symptom reproduction on the hamstring, right in the spot where he feels like it's kind of balled up. As soon as he raised his head, he had mostly relief of his symptoms, both in the back of his knee and in his hamstring. He also said he had some shin sensitivity, which is just another branch of the sciatic nerve, peroneal branch, that continued down into his lower leg. Then he did the other side, and he got definitely straighter. He got more full extension on that side. He had a little bit of sensitivity in the back of his knee, but not nearly the hamstring sensitivity on that side. Also, he had very little change when his head was up versus down. So if we're considering the left side the normal side, we know that his right side has more sensitivity to sliding. Let's talk about how to address these things. So to address the right-sided sciatic nerve tension, you're going to lie on your back. Same band around your midfoot. You're going to keep your head down. Your other leg's going to be straight. You're going to start with your foot dorsiflex, just like you did during the test, and you're going to bring yourself up to the point of sensitivity. Then you're going to start slowly pumping your ankle, keeping your hip at that initial point of sensitivity, so there's an on tension and then an off tension moment. On tension, off tension. Now the reason we're mobilizing the nerve using the foot is because the nerve will get the most tension, the most stimulation when you move the joint that's furthest away. So rather than moving the hip or the knee, which is a joint that's closer to the hamstring muscle, I'm going to pick the joint that's furthest away so that we get the best effect on the nerve in the middle of the thigh or higher up in the thigh. I'm going to recommend that you do 20 gentle reps as a starting point. If you feel like as you go the sensitivity decreases, you can bring the leg up just a little bit higher so that there's consistently an on and an off tension point. I would encourage you to do this really gently so that you're not irritating the nerve. And then after 20 reps, you're done. To address the nerve sliding sensitivity, you're going to sit up in the same position that you did the test in. You're going to slump your head, slump your upper back forward. On the side of sensitivity, injured side, in this case the right side, you're going to pull your foot to your shin. You're going to straighten your knee, to the point where you have sensitivity, which is going to start to pull the nervous system through the sciatic nerve all the way down towards the foot. Because the head is keeping it from fully dropping down, you're then going to lift the head and allow full sliding all the way down through the nervous system. I'm still staying slouched in my back, but my head comes up, so I'm looking that way. Then I'm going to lower them together. That allows the nerve to start sliding back up, and my head's going to pull it back up fully as far up through the system as it can. Then I'm going to repeat. With my foot up, I'm going to straighten, and I'm going to lift my head at the same time, pulls the nerve down, and we're coming back down. That allows the nerve to slide back up. Just like the tension exercise, we're going to do this about 20 times, relatively gently. Sliding, flossing the tissue through the system. If you feel like the sensitivity is decreasing as you go, that's a great sign. If you feel like it's getting worse, you want to let me know, and then we'll come up with some modification. Just like the tension exercise, we're not trying to be super aggressive with this. We're just going to the point where there's sensitivity, and we're backing off. Now, because you're lifting the head, you may find that there's actually not much sensitivity at all in the hamstring or anywhere else. Sometimes there's a nice warm sensation that you get in the low back. Hey guys, I realize this prescription, this advice is specific to this one client, but what I really wanted you to take away was the idea that the nervous system is something that you can mobilize. The nerve tissue is a tissue that you need to consider when you're healing injuries, and it's one of the reasons that people sometimes don't heal fully or even don't heal at all. It's very commonly missed. It's very important. So if you're having problems like this, seek out help from a provider that knows how to evaluate and treat this, or feel free to ask me questions or reach out, and I'm always happy to do a FaceTime or Skype call to help you get to the bottom of what's going on and give you some specific targeted advice that's appropriate for you. Thanks for tuning in. I'm going to make a couple of follow-up videos around how to mobilize the big knot that he has in his hamstring that's healing, to free that up, as well as how to then progress to strengthening the muscle so that he can get his whole posterior chain reintegrated and significantly reduce the risk for re-injury. So stay tuned for that. Click the like button. If you like what you saw, feel free to ask questions or make comments, and look forward to seeing you next time.